Combine that with the state budget crises that will continue to happen because of healthcare costs ballooning in every state on every level, the chances are very strong we'll get it. So that's a very long answer to a very short question. I apologize, but we can push at it.
You'll be next. Would you please introduce yourself before you ask the question?
I'm a retired intern and former president of the Long Island Coalition for National Health Plan. Let's talk a little more about New York. I'd like Len to address the part of this because he knows about it. Few other New Yorkers know that the New York State Assembly more than once has passed a single-payer bill. It was always routinely blocked by the Republican State Senate. The head of the Health Committee came from right here in Nassau County. But there is now a Democratic chair of the Senate Health Committee. But still, nobody, including people in this room, is really talking about efforts in New York State. Maybe we should change that. Comment.
We have to build the single-payer movement in this state, which has not been as nearly as active and as integrated as the movements in the states that Donna mentioned, or the Vermont she didn't mention. I think Vermont has been very active as well, and Massachusetts. The single-payer movement in Massachusetts has been more visible and more active in getting statewide referenda going. And we just haven't, in this state, we have an organization, we have single-payer New York that we're active in, but it's a very small organization and frankly not big enough and strong enough yet to mount a state. It's a big state with 19 million people, and our movement in this state is not up to that task, in my view, yet.
I would have to agree with Len. I'm just going to add, though, that single-payer New York, when I was you have a marvelous model there. That's a great model for activism and advocacy, and I really think it can grow, and it will grow if all of you as advocates and activists infuse energy into it after we get through this legislative process. I think that the model is very good because you've got people in that group who want to work on the national and people who want to work on the state who aren't at each other's throats, which is very nice.
Yeah, it's united, and there are activists in almost every county in the state in the organization. Just as you say, it has to grow.
Yeah, absolutely.
Me? You had a question?
Oh, me?
Yes.
This is really starting at the Esther Confino, Long Island Coalition for National Health Plan. I'm just thinking in terms of, we live in we're in Nassau County, basically, and we just elected a county executive, not we, a county executive who ran on a lower tax platform. My feeling is that we have to push them to admit that they're just the cost of buying insurance for county employees is a very big issue, and they're always talking, and then I, having spoken many times to individuals in the county to elect people, they're always railing against high taxes. Everybody is railing against high taxes. If we can prove to them that a very large portion of their taxes go to buying health insurance for employees of the county, for example, I can think of the fights in school districts about high real estate taxes. That's where it hits home. People talk about it. If you offer them a solution, maybe somebody will be listening.
Katie, I think that's a great opening for you to talk about the WinWin campaign.
Thanks. Well, if you haven't heard, Healthcare Now has a campaign that has a formula where you can plug in the local numbers for a school budget or county budget or town budget and find the savings. So this has brought in a lot of resolutions from local governments, but more importantly, every time you go in and make this kind of presentation to your elected officials on the local level, you're educating them about the savings. And, as organizers, we don't know always where we're going to end up. So the So this has been really successful on the local level, bringing in this kind of endorsement. It's hard to get media, and then, we need to work on that. But this Saturday at 1 o'clock, Healthcare Now is hosting sort of a web interactive conference call on the campaign to help walk people through what resources we have and how people can really get this going on the local level. And I think we have like 150 RSVPs for people who want to get involved around the country. So I'll make sure to get you the information, Esther. Great.
We have a couple of hands, so I'm going to just go around the room. So we'll start with Steve, and then Joanne, the gentleman over there, and then the gentleman over here.
I guess, once again, this may be for Donna, who has sort of that national picture. My concern has been the fork in the road going forward, that if something passes and costs go up and everything we predict will happen, regardless of what's true, basically the Democrats are going to be taking the blame for it, and the left, if you will, is going to take the blame for it. If it doesn't pass, even still. So the fork in the road going forward isn't just that we have to keep fighting, it's also the media perception, the public perception of who wins the battle of the failure of the current reform. Is it the right, who's going to say, regardless of what's true, is going to say, see, this is what happens when it's big government, we need more free market solutions, less taxes, etc., or is it what is true, this is what happens when you pre-compromise with the insurance companies, give them $100 billion subsidy, and then get them attacking you anyway. There's that fork in the road of who wins the battle afterwards, and I'm just afraid that the national media is already framing it as a win for the right. And we see that perhaps in the Massachusetts Senate race. So how do we drive that fork to the left and not to the right?
Oh, that's a wonderful question, but I think the Republicans have actually done some of the work for us this time if we're smart. Because wasn't it interesting that they became kind of the defenders of Medicare? It was quite interesting to me. It was disgusting at some levels, that they built upon the Tea Party folks and their fears that someone was going to cut their Medicare. Listen to how many times they were quoted as saying that somebody wants to cut your Medicare. Somebody wants to cut your Medicare benefits. They want to cut your Medicare benefits. Scare after scare after scare for the elderly on that issue. If we are smart, the way we reframe this and don't blame one party or the other, but blame them all for their failing on this, is that you're darn right you shouldn't touch Medicare benefits in any way except to extend them to all. You wouldn't be asking people, you wouldn't be scaring people with this if it wasn't something people valued. People wouldn't be afraid to lose it, would they? So we need to take that message of what the Republicans they used that so much, whether it was in the House or in the Senate, and they're going to use it again before Obama signs the bill if it's passed by both houses. They're going to use that again, the scare on Medicare, and we need to take that message that they used and say, you're right, we agree with you. Medicare is an awesome thing that we ought not to damage. In fact, we ought to make sure every person in this country has it. That's why I think the single most important thing that the single payer movement may have to do, even much more strongly than we've done in the past, is clearly identify with Medicare for all, agree that we need to do some improvement of Medicare, but make it a Medicare for all fight, and move it in that direction, because the Republicans have now gone on record as defending Medicare. That's the way we'll make it work.
There was a really good thing that I saw on the internet that was a graphic that had a picture of an old woman with a shawl over her in a rocking chair. It said Medicare, good enough for grandma, good enough for everyone, which is really, I think, a powerful message, because Medicare is so valuable. I mean, people fight for it, right? It has such a really good satisfaction rating, so compared to the private insurers, that's a good meme to put out there. That if grandma loves it so much, why shouldn't grandma's grandchildren have it, and why shouldn't I have it? Everyone should have it. So I think that we really do need, as a movement, a very strong branding campaign on selling Medicare, because really that's what we're doing. I think a national healthcare program confuses people, but everyone knows someone on Medicare, so I think the Medicare for all messaging is really important. And another meme that I've thrown out is that people will say, well, Medicare is going bankrupt. And I'd like to say, well, the reason for that is because Medicare is stuck with all the very expensive people that are very costly to insure. Let's expand Medicare to save Medicare. If we get everybody in it, then the government won't be forking out all the money just for the expensive people. They'll be able to get tax money for the people who are not, responsible for all the costs.